Tim Phillips, KLTZ.
Back to Montana PBS.
Bill Drake, Great Falls Tribune.
Eric Chalkum, KTVH.
Hello, this is the governor's office. Who do we have on the phone? Megan Lewis, ABC Fox. All right, we'll just give it a few minutes.
Casey Page and Mari Hall, Billings Gazette.
Cornelia Nicholson, Color 8.
And Mitch Laggy with KCDQ in Billings.
KFAX.
Good afternoon, this is Steve Bullock. Thanks for joining the call. Yesterday evening, we announced 4 presumptively positive cases of COVID-19 in the state of Montana, marking the first for our state. We've certainly been both monitoring this rapidly evolving situation, vigorously preparing for COVID-19 to reach Montana, making yesterday's news in some respects unsurprised. 4 positive cases are in the counties of Gallatin, Yellowstone, Silverbow, and Broadwater. Please report that all 4 patients are at home in isolation and recovering. Shortly, Dr. Greg Holtzman, who's the state's medical officer, will provide an update on the 4 individuals' exposure risk as well as their travel history. I'd like to thank all in the media for your patience as we worked yesterday evening to disseminate the information we had available at the time to the press and to the public. Both BPHHS and local county health departments have been working around the clock to gather further information in order to both mitigate risk, but also to keep the public informed. I am certainly grateful for the incredible partnerships we have with our local county health departments that truly are on the front lines. Through their work, that we're able to gather the best information possible on patients with a commitment to keeping the public safe. I'd also ask all of you that during what are challenging times, we give our local county health departments the time and support that they need to ensure that we have the best and the most aggressive response possible. Also like to provide a few new updates. So the state lab is performing testing. We'll be disclosing results today, and we'll be performing testing 7 days a week starting Monday. Informational line and email address for Montanans to ask questions are up and running. Public health staff are working through providing responses to folks that call and email in, including this weekend, with additional support starting on Monday. I just put as a reminder, and it's great if you all continue to put in your stories. Informational line number is 1-888-333-0461. That's 888-333-0461. And the email address is covid19info@mt.gov. COVID19info@mt.gov. In addition, yesterday I amended the state amended my executive order for our Montana state of emergency just to align the effective time frame with the federal state of emergency declaration announced by the President. What that means is that our state's emergency response will be in effect so long as the federal authorities believe that there's a continuing threat, allowing us to continue to mobilize state resources as long as necessary, and it's no longer constrained by state law timeframes. We have certainly been planning and preparing for these days to come to Montana in the coming days and weeks, in a recognition that this is dynamic and things are rapidly evolving. We'll continue to make decisions both in the best interest of public health and committed to doing everything we can to keep you apprised of any new developments. Again, I can't stress enough the importance of the role that the public needs to play, though, in helping us mitigate the impact of this virus. The small sacrifices that we can make now, missing out on a canceled events or avoiding large crowds, enjoying time with small groups of healthy family and friends, and most certainly staying home if you feel sick, that does mean keeping more folks healthy in the long run. We always have to recognize the person ahead of us in the grocery store could be among those most at risk of falling ill to the virus. I am receiving further briefings throughout the weekend on how we can flatten the curve of the disease, and as I've said, it's dynamic. We'll probably have more guidance next week. As Montanans, I trust that we'll do everything we can to help our fellow citizens. Thanks. I'm now going to turn it over to Adjutant General Quinn to provide an update on the task force. Then we'll turn it over to Dr. Greg Holzman, the State Medical Officer. General?
Thanks, Governor. I'd like to update everybody on the task force that Governor Bullock established about a week and a half ago. I'm in constant communication, as is the Governor, with the task force members. I'll run through those members quick. Department of Public Health and Human Services, Department of Commerce, these are all state organizations, Department of Labor, Department of Administration, certainly the Governor's office, and within the Department of Military Affairs is our Disaster and Emergency Services shop, headed up by Delilah Bruno. We have established a new website at COVID-19.mt.gov. Charlie Oscar Victor India Delta 19.mt.gov to keep the press and public informed of actions taken and decisions made by the task force. I'll talk about the incident command structure. We are working very closely with our county health organizations, and as the Governor said, they are out there every day doing the work with the local population and need our support. If a need arises at the local county level and the county asks for the support of the staff, that's where the state will be able to step in with the resources as necessary to assist the county agencies. We have stood up the State Emergency Coordination Center. It will be coming on full-time starting on Monday. That's a multidisciplinary team that will report directly through or to me through Delilah Bruno. And again, they'll be on full-time status to bolster our response efforts. The team itself will be located out at Fort Harrison in a centralized location. I would just like to remind everybody is what happens when disasters arise or emergencies arise. We see the same thing occurring with this pandemic when it comes to the spread of information and misinformation. I ask that we all be sure to take responsibility during this time and wait for test results and confirmation from public health officials. We here at State are committed to providing accurate information as quickly as possible and making sure that all Montanans have a place they can go to for information that they can trust. At this time, I'll turn it over to Dr. Holzman.
Hello, thank you. So, just to reiterate, Montana is reporting 5 cases currently, including that part-time resident who had not been in the state at the time of their exposure or diagnosis. Local public health agencies are continuing to investigate the 4 new cases that were reported last night, and early information is very encouraging. All cases appear to have acquired the infection outside of Montana, and none have required hospitalization to date. To go through each of the cases, First case is a male in his 40s from Gallatin County. As stated, he's not hospitalized, and he had traveled internationally. Case 2 is a female in her 50s from Yellowstone County, not hospitalized, and also had traveled internationally. The third case is a male in his 50s from Broadwater County and had traveled domestically from an area that we know has person-to-person spread of the COVID-19. Case 4 is a male in 50s from Silverbow County, again, not hospitalized, and again, traveled domestically to an area of known person-to-person transmission. All 4 counties are working on contact investigation with assistance from the State Health Department. Fortunately, information collected so far indicates that most had self-isolated and had their household members, In addition, early indications are that healthcare providers and patients made every effort to minimize risk in the healthcare setting. So our next steps here local public health staff will be reviewing information gathered from interviews with patients and healthcare providers to determine who might have been at risk. Individuals identified as close contacts, and I can go into more detail of that if needed, will be counseled regarding risk and the level of quarantine and monitoring they will be asked to comply with. Anyone who is identified as a close contact that has or starts to develop symptoms of concern will be isolated and tested for COVID-19. We will continue to work with healthcare providers to ensure laboratory testing is available for individuals who have compatible symptoms, and we will continue to update the public on progress made in our efforts and share relevant information as it becomes available. Thank you.
Great. Any questions from folks on the phone? And please just identify who you are and who you work with in asking the question.
Yeah, this is Mike Dennison with MTN News. Is the state lab working today? Is it doing looking at testing or test results today?
Yeah, Mike. State lab is testing today. We plan on testing about, I think it's 51 people today.
Okay.
So once again, just like yesterday, when we get those results in fairly short order thereafter, we'll put out something.
This is Holly Michaels with Lee Newspapers. Just wanted to see what's the turnaround from when a person is tested to when those results are out. And for Montana's 4 presumptive cases, when were they tested?
What was the end of that, Holly?
Oh, for the 4 presumptives, when were they tested?
Yeah. This is Dr. Holt.
Once we get the test to the lab, we run the test that day. So at this point in time, the test will be sent to us, and once we start to run the test, we usually can get the answer back in 6 to 8 hours of running the test. So it depends when it shows up and then when we get the batch together to start going. But we are the fastest ones to be able to turn it around at this time compared to some of the private industry that is now coming up. So we're trying to move those as quickly as possible.
And Montana's 4 cases, were they tested yesterday then?
They were tested yesterday. As soon as we got the results, we gave to you.
Okay.
Or I think within an hour's time.
Awesome. Thank you.
Absolutely.
Madison Donor, NBC Montana.
Sorry, who?
Madison Donor with NBC Montana.
Yeah.
Viewers are sending in emails and calling upset about people hoarding products. So for the governor, what's your message to those people that are stocking up on products when, they shouldn't really be panicking right now, more like planning, but, they're hoarding things like baby formula and things that some low-income families really need right now?
Thanks, Madison. Yeah, and the message is certainly to plan and prepare, but not to panic. I mean, we've seen that happening all across the state, and this is something that we need to take seriously for sure. That don't check common sense at the door as you do so, I think.
Yeah, thank you.
Thank you.
Governor, this is Corin Cates Carney with Montana Public Radio, with a lot of people talking about working remotely, social distancing, self-quarantine. What does that potentially mean for government agencies and if departments are starting to work remotely, and how will those maybe services still run if government workers are working remotely?
Sure. So two different buckets, if you will, Corin, and thanks for the question. On Monday, we're going to be providing guidance to state employees. Part of those policies will provide 2 weeks of paid leave for state employees who are required to quarantine, and up to 30 days of paid sick leave will be available in the event that a state employee is sick with COVID-19 and needs medical care. Certainly been encouraging. I've been the federal government to act quickly on legislation to provide emergency sick and paid leave beyond, just our public employees, and encouraging all private employers to offer paid leave to their employees if they're directly impacted. As things go further down, as I've said time and time again, this is dynamic. Like right now, we're not shifting to non-essential folks working from home or anything like that. But it is something that state employees overall will get further guidance on Monday, and we're continuing to both work with individuals, families from a department to department basis.
Thank you, Governor.
This is Dr. Wilson. I'm asked to make one clarification so people are clear. Let's say that when we get within 24 hours, we're running, going those things. So if something comes in at late on one night, I don't want people to be thinking that it would come back that day.
Yeah. Holly, if as an example, if swab showed up at 6 o'clock on tonight, that doesn't necessarily mean you have the answer 8 hours from now. Okay. You passed the test.
Okay. I was wondering, this is Phil Drake from Great Tribune, was wondering, is there any way to determine what kind of economic impact this has had on the state? And I also wanted to know, would your executive order have expired after 30 days? Had you not done, amended it to fit in with the federal one?
Still two questions. No, there hasn't been any assessment of the overall economic impact yet of this in Montana or indeed across the country. And this is the same with fire emergencies and any other state of emergency. After 30 days, there's a possibility of a renewal for an additional 45 days. Why I amended that executive order is to make clear that it doesn't expire 30 days from now and then having to go the next 45. And if for some reason that Montana was still under a state emergency, in my estimation, when the federal was lifted, then I could have potentially another 75 days after federal action is complete.
Connor McCauley, KPAX News in Missoula. I was just wondering about the availability of tests.
Yeah, two things. First of all, right now we have approximately 850 tests available. We're going to be requesting additional kits from the CDC that should arrive soon. We haven't had any trouble receiving nationally the tests that we request. Moreover, some healthcare providers have utilized private labs where they send it outside of Montana, and will probably continue to do so. But also want to be clear, because I think there was some reporting that people weren't being tested due to a shortage of tests. We're not refusing tests to people who are experiencing symptoms consistent with COVID-19 due to any shortage. Every sample that's been submitted to state health labs has been tested. We'll continue to follow that protocol. And as of now, we haven't had any issues getting tests from the CDC.
This is Eric from KTVH. This is Eric from KTVH. What is the transfer protocol for tests, especially from some of the more remote locations in Montana, namely Northeast Montana and places east of Billings?
This is Dr.
How are those tests getting to Helena?
So we have a transport way that goes by different hospitals that we do all the time for all sorts of tests that need to come to the state. That usually runs 5 days a week. With this going on, we are moving it to 7 days a week. And those tests would be given to those couriers and brought to the state lab so that we can do testing. So that's the general protocol on how we go about that. There are some unique circumstances where we can do it other ways needed.
And this is Bullock. I guess one other thing that would add, like there are parts of, especially in northeastern Montana, where there's not like an easy place necessarily, with sort of these scheduled stops, and we're working in coordination with the Highway Patrol to figure out any gaps that might be able to be made that they could actually carry some of the samples for us.
This is Megan Lewis with ABC Fox. Governor, I actually have a question for Dr. Holtzman. Dr. Holtzman, you said that one of the cases was out of Broadwater County. Governor, your press release says Lewis and Clark. Can we get clarification on that? And I have a follow-up.
Sure, and I thought it was corrected last night. Go ahead, Dr. Holtzman.
So in trying to get out the information to you all as quickly as possible, the test was done in Lewis and Clark. The individual is a resident of Broadwater County, and that will be a challenge as we go forward. We want to get some time to be able to clarify that information and get it out to you so we're getting you the right counties.
Got it. And just a quick follow-up for you, Dr. Holtzman. Can you expand any at all on the two that traveled domestically, where they were?
Yeah.
They were in the state of Washington.
Perfect. Thank you.
This is Justin Franz with the Flathead Beacon up in Kalispell. Has there been any discussion about statewide school closures, or is that going to be something that's going to be left up to individual school districts?
Thanks, Justin. So, made no determinations as far as broad school closures at this time. We're looking at both the newest recommendations from the Center for Disease Control. We know that schools also can be, like, one of the challenges of overall closures that really can be a lifeline for low-income families in our state, can also impact workforce, healthcare providers, and others. But we're working diligently with local school officials who may have questions, and also with the public health authorities to act responsibly. Now, if we do get to school closures, also going to work to make sure that schools could close without losing any of the state funding that they've received. Also, OPI, Office of Public Instruction, have already submitted a waiver request to the USDA, Department of Agriculture, to allow school nutrition flexibility so that students could continue to have access to meals. But so no blanket determinations have been made to date.
Thank you.
Yeah, Alex Sackerson with Montana Free Press. Dr. Holtzman, I was curious, do you have any information on when, like any time lapse between when the presumptive positive cases returned to the state and when those tests were done?
So I can give you just a general protocol of how the process goes, and not speak specifically on any one of these individual cases. But any test, when a test is done and a provider is thinking of COVID-19, that is immediately reported to local public health. And local public health works with them to get the materials up for us to do testing. Local public health will move right at that time, along with the provider, to let that person know that they should stay in isolation until we have a clear answer back. So for all these tests that are being done, most of them luckily negative, all those people should be in that situation until we get a clear response back and can get it back to them.
Thank you.
Dr. Oldman, Sheila Callahan at Mountain Broadcasting. How many negative tests have you done?
Sheila, even I could answer that, and I'm not even a doctor. So far, we've tested 107 people. So of that 107, right, we've had 4 positives. We're testing about 51 people today.
I have a follow-up question.
Sure.
Does the fact that the 4 people that have tested positive, were from such disparate areas of the state, does that give you any pause?
Pause in what way?
That they may have infected people in several different areas.
I mean, the typical way for doing a trace back is first thing to meet with those people and see if we can figure out a reason why they might be test positive. So we put the percentages where they're most likely. Then to be as safe as possible, then we start doing trace back of anybody that has been in close contact with them. Find out if anybody's having any kind of symptoms, and then those people would be tested. If they're not having symptoms, put them in quarantine for 14 days. And just the terms that we use quite a bit, and I just want to clarify so people know, isolation means that the person is sick and is being put in isolation. A quarantine person maybe something is a person who does not have any symptoms but has a high-risk exposure.
Thank you.
Anybody else?
This is John Stepanek in Billings. Do you have any projections for the number of cases you expect in the next week, the next month, or the next half year?
We don't, John, and that's not unique to Montana. That's all throughout the country.
Governor, this is Corin Cates Carnegie with Montana Public Radio. Wanted to ask about state's emergency funding and what is being used right now, what current levels are, and where the state might be getting other additional funding to pay for some of these efforts.
Sure, yeah. So with the state declaration then was able to free up $16 million of state funding in that emergency fund that can be used as soon as it's needed. CDC also made $4.5 million available to our state. We'll have a call with the CDC in this upcoming week to learn a little bit more. President Trump made available through his declaration. It's going to allow financial reimbursement for extraordinary eligible costs after we've exhausted some of the state pieces. So right now, and we just did the declaration a couple days ago, but as we look at everything from, let's put one example, making sure that the hotline is adequately staffed. If there are things that we need to do, we'll have the resources to do them.
Thank you.
This is Holly Michaels, just with one more question. I know earlier in the week you had said that it was up to healthcare providers' discretion on when tests would be conducted. Is that still, I just want to make sure that's still where we're at now, and if you would ever see that changing, and what sort of recommendations you want to make sure those healthcare providers are looking at or following, if that's from the CDC or where, when they're deciding to issue those tests or not?
Well, it is up to the individual healthcare provider to say that a test should occur. And do you want to talk about sort of the basis of?
Yeah, I can go through what we're doing, but this is just like many other tests that a provider would do. So it's going to have to be ordered and done by a provider, and then that information would be sent up to the state. Deciding that they go through our system. They could go to some of the private labs. No matter what, the provider under state rules right now is supposed to notify local public health, whether they're sending it to an out-of-state lab or to us. And the reason for that is so that we can start our move movement real quickly, and when I say our, I'm talking about our colleagues at the local public health, to make sure that that person is doing the right things to not possibly affect anybody else until we have a definitive result back. So it's a matter of coordination of everything that's going on, but the test has to be ordered by a healthcare provider.
And it's, Holly, as you might imagine, the individual doctor is much more, I guess, prepared to assess does the individual have the flu or other things, so that's where the initial screening should be, is with the individual healthcare provider.
This is Phil.
Nick
I was just wondering.
Nick
the time to turn it in.
Why don't one of you go? Phil, why don't you hold out? Whoever was just talking, go. Then Phil, you're next.
This is Nick Petroccioni with KBZK. Governor, the state tournament's being canceled yesterday. Your daughter obviously played a lot of high school sports. How do you react to those, and are you worried about any of those kids that came in contact with those large tournaments?
I missed part of the question. My daughter played. It was canceled.
You played a lot of. What was your reaction to the state tournaments around being canceled, and are you worried about any of those kids coming in contact with those large groups of people?
Well, I think a couple of different things. One of which is that, I think that Montana High School Sports Association erred on the side of proper caution in awarding sort of the dual state champions, where it might be disappointing for some of the individual players doing things to keep everyone safe. We always have to recognize, too, that, on the one hand, our younger folks are the least susceptible to significant health challenges because of COVID-19, but any aggregation of a large group of people, there is always the potential for spread of this and every other disease. So.
This is Phil. I was just wondering, from the time it's turned into the CDC, is there any kind of turnaround when they say take it off presumptively positive to positive? I apologize if you've answered this already, but I didn't know what the next step is from when the state.
Oh, from presumptively positive to positive? All right. I'll give that one to a doctor.
Yeah. So at this point in time, and it very well might change very quickly, but any tests that are done at the state laboratories are considered presumptively positive, and we send them off to the CDC for a secondary testing. That makes no change in how we respond to the situation. We consider that case a positive case, and we move as if that's a positive case. So that person will be isolated, their close contacts will be quarantined, and we move forward from there.
So does the CDC then come back and say, yes, this person is positive, and then you take it off a presumptive list? Or
at this point in time, I have not heard of one case that has gone that way. But if we got back an answer that they got negative and we got positive, we'd have to have a serious discussion with them and figure out the next steps. But at this point in time, even if that was to happen, we are erring on the side of caution all the way through, and the people are doing the right things to try to prevent the spread.
Anybody else?
This is John again from Billings. Will the state process the tests from our Indian reservations? And are you concerned that as of right now it doesn't appear that Indian Health Services has any test kits?
Yeah, yes, the state will process, and as far as Indian Health Services, go ahead, Dr. Holzman.
They're on the same areas of pickup and sending in lab as we do all the time for all sorts of other things, not just this. So all the tribes can submit. And the Indian Health Service has their own physician as far as the charge of IHS in Billings, and I am also in contact with him, and we talk about different issues if necessary.
Yeah, and John, I think I part of the question too is that, and I spent some time at the lab this morning, like it's not like we have the almost 1,000 test kits spread out all over the state. So what ends up happening is typically you use a Q-tip, a buccal swab inside your mouth, and that's what then is sent to the state lab.
Oh.
Or in your nose. I'm sorry, in your nose. I guess I was thinking DNA checks for vendor registries, but they put it in your nose, not in your mouth. And what that does, right, it grabs the DNA and things like that, and then we do our magic at the state lab.
This is Megan Lewis with ABC Fox again. Just two quick questions. Are we still encouraging people to get flu shots at this point in the season?
Absolutely.
Okay. And Governor, will you be continuing to hold these press conferences on a regular basis, or what's the plan going forward to get the word out?
Yeah, Megan, doing everything I can to add as much transparency to all of this as I can. So we'll be, whenever there's additional information that we receive that might be of importance to the public and the press, we'll release it even if we don't have a call like this, but I'm sure that this won't be the last time we speak.
Thank you.
Connor McCauley with Missoula again. Is there any thoughts to travel restrictions?
What sort of, you mean like that people can't come into Montana or leave Montana, or what specifically are you referring to, Connor? Because there's some national travel restrictions right now from certain countries of concern.
Yeah, coming into the state, especially from Washington.
No, not at this time. We can't shut down like the state interstates or anything like that.
All right, we have time for one more question.
Governor, what's your biggest concern?
Like, there's a lot. I mean, from the perspective of mostly our vulnerable populations, like we have to recognize that those over 70, those that are medically frail, those are the ones most susceptible to mortality. And that this is a challenging and in some respects scary time for a lot of people. They'll recognize both who's most at risk, what we can do to, even if you can't contain these risks, to mitigate them. And let's all try to work as Montanans constructively together as we have in the past. I've said more times than I wanted that this is a dynamic situation. I think it'll continue to be a dynamic situation. But more than anything, when we look at both the contagion and its spread, that we've got to take care of our legacy Montanans, our older Montanans, at each and every step. Thank you all for spending a little bit of time, and we will continue to update you as we get additional information. Thanks.
Thank you, Governor.
Okay, and now what I'd like to do is introduce to you John Felton, who is the health officer for Yellowstone County, as well as the Riverstone Health President and CEO, and he's going to update you on the situation today.
All right. Thank you all for coming. I'm here today talking on behalf of the Unified Health Command, which is a coalition of Riverstone Health, Billings Clinic, St. Vincent Healthcare, and Yellowstone County Disaster and Emergency Services. This is our community's way of working together to address large health-related issues. So, first of all, I think it's important that we always keep a human face on this. We have a real person in our community who's been diagnosed with COVID-19, and I think we never want to lose sight of the fact that this is a real person, and certainly we're concerned about her. We're making sure she's getting well cared for, and that we wish her a speedy recovery. We've been talking for a while that this was really a matter of time. Several weeks ago, I believe it was CDC said it's not a matter of if, but when. About a week or 10 days ago, the Surgeon General started talking about we need to be working on mitigation strategies, that prevention is important, but the time will come when we need to mitigate. Fortunately, in our community, we have been working on those mitigation strategies. So this is not a surprise that we have a case in our community. It was a matter of when that would happen. One thing I think is really important is we will not share extensive identifying information about this person. This is a member of our community who deserves the privacy that we all deserve. I can give you a little bit based on some of the things that Dr. Holtzman said. This is an individual who did have a positive travel history to another part of the world that was affected by COVID-19. Also, as Dr. Holtzman mentioned, there's a specific process that's followed that's guided by CDC direction for home isolation while the person is ill, while the test results are pending, followed by identification of potential contacts, and following up with those folks to determine their level of risk and the appropriate follow-up, whether that's home isolation for them or whatever that appropriate follow-up is. CDC guidance is pretty specific on how we do these things, and as a community, we've been following those guidelines very closely. Last thing I want to mention is a concern that we really want to pay attention to, and that is the concern of false information, of rumor, of suggestion, of my brother-in-law's nephew said. It's really important that we have people in our community seeking reliable sources of current information. So that is, for our community, that is the Unified Health Command. So you also have access to CDC guidelines, CDC website. I'll give you in a little bit some phone numbers that are available locally. But it is really important that we make sure that the information that's going out is accurate, it's current, it's reliable. It does change as time goes by, but it is really important at this time that we focus on good information. This is not a good time to be making jokes and trying to be sort of provocative and interesting by saying things that are based in rumor. So we encourage everyone in our community to really pay attention to reliable, accurate information. At this time, I'm going to introduce Dr. Neil Koo. Dr. Koo is an infectious disease specialist with Billings Clinic, and he's going to give you all a little more details about the process that happened with it when the confirmed positive individual entered the healthcare system. So, Dr. Koo.
Good afternoon. On Thursday, a Yellowstone County woman in her 50s presented to the emergency department at Billings Clinic with mild respiratory symptoms. She was triaged with enhanced screening protocol. She was then placed in a room in accordance to appropriate precautions. All medical staff involved in her care followed appropriate protective procedures. During her evaluation, respiratory samples were collected for COVID-19 testing. As she did not require hospitalization, she was discharged home with instructions that followed appropriate home isolation guidelines. On the following day, when the results was available, she was promptly contacted and instructed with further detailed instructions regarding home isolation. Additionally, the Yellowstone County Public Health was also notified. All medical staff involved in her care were apprised of the situation and currently being monitored for symptoms. The follow-up of this patient is currently being conducted by Public Health. Thank you.
Thank you, Dr. Koo. What I'd like to do now is give you all an update on what's going on with the Unified Health Command. We presented some information to you yesterday. This is an extremely fluid, very dynamic situation, and so there's a lot going on very rapidly. Yesterday when we talked, there were no cases, so things change. So here's some things that have happened just really in the last 24 hours. Both hospitals, Billings Clinic and St. Vincent Healthcare, will be opening some testing sites tomorrow. St. Vincent Healthcare site will be a tent that's located in parking lot M, which is the northwest corner of North 27th Street and 11th Avenue North. That's the St. Vincent site. Billings Clinic site is located on the west side of the hospital building in the former dialysis space, and patients will be directed to that location. This is really important to remember. Testing is only available with a physician order. This is not a scenario where patients can come up and just walk in and say, I'd like to be tested. They must have a physician order for that specific test. And again, that starts Monday. Did I say tomorrow? Sorry, it starts Monday. I've been on Sunday all day. Another thing that's going on is we continue to follow the guidance from CDC with respect to testing. The criteria that are assessed in determining who gets tested and is appropriate for testing are the symptoms, what their close contact history has been, what their travel history has been, those who are hospitalized, and the elderly and those with chronic conditions. Those are all sort of pieces that go into the decision to test for COVID-19, according to CDC. Again, patients may not self-refer for testing. The test must be ordered by a licensed healthcare provider, following an appropriate clinical assessment of the factors that I just mentioned. You heard from Dr. Holtzman and Governor Bullock that there are tests available through the Montana Department of Public Health and Human Services at the Public Health Lab. We started with 1,000 tests. As we just heard, there's about 850 left. And we anticipate getting more test kits in the next week. I think whether you're talking about drawing the specimens here or anywhere, again, we need to remind our residents that must have a physician order and have gone through the testing protocol. We have some hotline numbers for you for some additional information, and we'd appreciate if these were published and can be made available to people in our community. These are all 406 numbers. Billings Clinic, the Healthline number, 406-255-8400. St. Vincent Healthcare, their number is 406-237-8775. And Riverstone Health's Public Health Information Line, 406-651-6415. So those are reliable sources of information. We know that this is respiratory illness season. There's a lot going around. So some standard advice for folks who are experiencing respiratory symptoms. If people are sick and with mild symptoms, they should stay home and self-isolate. In other words, stay away from other people. The decision variable is really what would you have done in terms of seeking care if we weren't talking about COVID-19. So if an individual feels, if we weren't talking about COVID-19, I feel sick enough that I would go to the doctor, then they should go to the doctor. If they feel like if we weren't talking about COVID-19 and if I felt like this, I would just stay home, they should stay home. If they feel like absent COVID-19, if I had these symptoms, I would go to the emergency department, they should go to the emergency department. The fact that we have a case in our community shouldn't change the way that people can have historically and continue to seek care. Another important update, we talked about this yesterday as something we're working on, is a centralized testing site. The county commissioners and Metro Park have graciously approved the use of the Sandstone building as a centralized testing site. That is not yet open, so please don't make sure that's clear that we're not sending people there. There are some logistics that need to be taken care of. We will continue to share details with the community through the media as those details are put together and we're ready to open that site. But we do have a site. Thank you to the commissioners. We've also, over the last 24 hours, completed some community guidance that we want to share with you and ask you to share with our community. One came up on the governor's call, and that's related to school closure. So this is from the public health perspective, from the authority of the health officer. We have no intention at this time from public health to close a school absent a known case. If there is a case that's related to a school, whether we're talking about a student, a staff member, a faculty member, perhaps a volunteer who spends a lot of time in the school, as the health officer, it'll be my responsibility to make the determination to close that school, that particular school, for some period of time. We're probably talking about a few days to a week. That could flex a little bit depending on the circumstance and sort of what else is going on in terms of circulation in the community and what we find. This is a process that was developed in concert with the health officers from the 7 most populous counties in the state to make sure that, although these are always local decisions by the health officer, we're trying to have a relatively consistent approach to school closure. Importantly, nothing in this guidance that we've developed, this process we've developed, in any way alters or diminishes or otherwise affects the authority that school boards have to take action with respect to their school or the authority that school superintendents have. This is strictly the public health response to a case in a school. We also have 2 other guidances that the Unified Health Command approved today that we will be getting out. We need to sort of get them into final form, but these are important guidances that we need to get to the community. One is a guidance regarding large gatherings. When you put a lot of people together, you're likely to have some folks in there who are more vulnerable to severe illness than others, and you're likely to have that close contact within 6 feet. So our guidance, which at this point is a recommendation that we hope many will follow, is if you need to have adequate space in a gathering for people to have 6 feet between themselves. If they don't have that amount of space, then the room is really too small, and our recommendation is that that function be either moved to a larger space or canceled. We want to keep that idea of 6 feet of space between people. The second guidance that we will be publishing, we completed, we'll be publishing very soon, is related to community activities. These are things like Little League teams, cheerleading programs, dance programs, travel teams, those sorts of things. That's not an exhaustive list, but it's that kind of community work. The concern we have there, first of all, is travel, and secondarily, when people come to watch those events, whether it's a concert or a baseball game or a softball game, whatever it might be, again, there's a high risk of getting vulnerable people in there in that setting. So our recommendation is that those activities be canceled, that we just simply not do those types of things this year to reduce the risk of exposure. All of us have a role to play in reducing the risk of respiratory illness, including COVID-19. Remember, we are still in cold and flu season, so the precautions that we've talked about over and over are still in place. Those, just make sure we get them out one more time. Thoroughly and frequently washing hands, avoid touching your face, avoid large crowds. Hopefully our guidance will help people realize what a large crowd is. It's not necessarily the number of people, it's the number of people you put in a space. And remember that 6-foot space. Encourage all family members to cover their cough and sneezes with a tissue and then throw away that tissue. Social distancing is really a key mitigation strategy. That helps to avoid exposure to many viruses. So again, avoid those crowded and closed spaces. Now is a time to greet people, but overcome our typical common practice of handshakes and hugs and just tell them it's nice to see them. There are a number of sort of high-touch surfaces we have, so that could be things like computer keyboards, door handles, tabletops, handrails, remote controls, things like that. Those need to be cleaned frequently. Standard cleaners seem to do well. So just as we close here before we open up for questions, again, I think it's really important that we all remember that the people who are confirmed to have COVID-19, the current individual and any future, are real people, and we need to be concerned about their welfare and their recovery. And as I said, this is an extremely dynamic, fluid situation. We will be changing what we know as we learn. We'll be changing guidances as things change. So as those sort of substantive changes happen, we will be inviting the media back and reviewing those kinds of things. So with that, we can open this up for questions. Sure.
Can you go into sort of the isolation guidelines that the patient with COVID-19 had to undergo in terms of her home isolation?
Yeah. So basically that what we would tell patients is stay away from others. So stay in a room. We would like, for instance, you don't want to sit down and have meals together. Have someone bring your meals to your room. It's really, we would need to keep distance so that the virus doesn't easily spread from person to person. It's nothing more dramatic than just keeping away from the individual.
And I'm just curious, is this a legally obligated thing, or are they asked to do this?
To date, we have not issued any health officer orders mandating isolation or quarantine. Much as we talked about those guidances, at this point they are all recommendations and requests. Certainly the authority of the health officer to mandate those things is not taken away. We would just much prefer that we can do it jointly as a community rather than having to get to the point of issuing those orders.
The Sandstone testing site, when that's open, is that going to supersede the clinic site and the St. Vincent site, or are those all going to be open at the same time?
I think our intent is to go to a centralized testing site. There will still be some testing at the hospitals, but one of the things that we're trying to accomplish is taking some of the pressure off of the hospital environments. And so we'll want to get folks to, once they've been to their provider, they've received the order for the test, we would like to get them to a place where we can have more capacity at our hospitals.
And where is the Sandstone building located?
It is at Metro Park. Let me see if I have the southwest corner. Thank you. Southwest corner of the Metro Park grounds. Yes?
I'm just curious, this might be for Dr. Cool, maybe Dr. Bush, what the communication's like with the state testing lab, and how is that? Are you in constant communication? And this is, actually, I'm cheating. Holly Michaels asked me to ask you guys how the state lab communicated the fact they're going to a 7-day opening instead of 5 days a week, and whether there were any issues with the communication with state lab.
From public health, we've not had any concerns. We're in very frequent contact with our colleagues at the State Health Department. In terms of specifics with the case, I'll turn to Dr. Coop.
No, the state public lab is in direct contact with our laboratory at Billings Clinic. So usually the results are kind of sent to them first, to the laboratory first, and then we get then the medical technicians are instructed to contact infection control practitioners or me directly with the results, and then we then disseminate the information to the appropriate parties.
So it's kind of through the lab.
Yes. And our end, it's actually the infection prevention nurse who's communicating directly with them.
Okay. And so no hiccups with that so far.
So could I clarify one thing that John said earlier, which is he said if you think you might have it and you would normally go to the doctor, go to the doctor. If you could please insert something there.
If you think that you've got an upper respiratory infection that might be COVID, don't just go to the office. Please call the office first, and then they can be prepared to receive you so that you're not just walking in and suddenly exposing a bunch of people. Thank you.
Another maybe medical clarification on, just to be perfectly clear on some of what Bullock said, is how is the test conducted? With the swab in the nose, is that?
Yes. So the question is how is the specimen collected? It is a nasopharyngeal swab, yes.
Okay.
So.
And it's the same, we have a testing process whereby it's still more common to have influenza. So we typically will do an influenza test on the swab. Then if that's negative, then we will send it for the COVID test.
So it's the same process as an influenza test?
Correct.
Hi. Okay, so throughout the state, many health facilities are having press conferences like this one. Is there measures that we're taking that differ from different counties in the state?
You know, I've been in contact with a number of other health officers. I think we are all largely on the same page. There's certainly some differences related to the players in different communities. In our case, the Unified Health Command has been around for a long time, so that is our mechanism. In talking to the health officers in the larger counties, more populous counties, they're all working very closely with the same players. They're working closely with their hospital partners, the local city and county government, school districts. So we're all kind of essentially playing off the same playbook.
Okay, if there aren't any more questions, we will let you go so you can go and file your stories. If you do have more questions, I'll give you my business card on your way out, and you can give me a call for clarification. So thank you all for coming today, and we will be seeing a lot more of us in the future.
Thank you.